Welcome to The Data Pulse, a data-driven health podcast breaking down key health trends and insights in South Carolina. Brought to you by the South Carolina Department of Public Health. Visit dph.sc.gov/tracking. Better info, better health. Here's your host, Tony G.
Welcome inside this edition of the Data Pulse. I am your partner in praise, Tony G. Today we talk with Sonya M Younger. She's the Director of Comprehensive Cancer Control. We talk cancer prevention and early detection and more after this.
Are you looking for accurate data for school projects, grant applications, or business presentations? SC Tracking has that. Go to dph.sc.gov/SC Tracks. SC Tracking tracks state and county level data. It's easy to get started. Visit dph.sc.gov/SC Tracks. Better info, better health. Brought to you by the South Carolina Department of Public Health.
We're talking today with Sonya M Younger. She's the Director of Comprehensive Cancer Control at SCDPH. How are you doing today?
I am great, Tony. Thank you so much for the opportunity.
Absolutely. Let's start by talking a little about you and how you got involved with SCDPH.
So I have always loved public health and being able to share information and opportunities with the community at large, with partners, etc. And so when I saw the chance to work with the Department of Public Health, at the time it was DHEC, to come on board and talk about cancer, I was like, this is a great chance to talk and educate the public on the less common known things about cancer. So yeah, I've been doing this for over 12 years now, and I love it. Love every moment of it. I love seeing the lights going off when people get the information that they didn't need before, and they have some actions and something they can take back home and work on.
So let's talk about the role of DPH's cancer section.
Great. And here's the part I love talking about, Tony, when it comes to cancer, especially, and again, thanking you for this opportunity, that we can shed some enlightenment on a subject that can be tough to talk about when it comes to cancer.
Sure.
And so when it comes to the rates, although the rates are improving, cancer remains a major public health concern both in South Carolina and nationwide. Lives can be saved through prevention efforts and early detection, including screenings and exams. And the Department of Public Health cancer programs play a key role in reducing the burden on cancer across the state. Our goals are to reduce death and new cases. We want to promote cancer prevention through providing education and outreach to the communities and organizations about healthy lifestyles. We provide trainings that provide the most up-to-date research information that could help providers to provide the best quality services to their patients. We also encourage early detection and screening for the leading cancers like breast, cervical, colorectal, lung, oral, prostate, and skin. We collaborate a lot with organizations and healthcare systems to make policy and system changes for a broader, sustainable reach. We support survivors and caretakers through education and resources like cancer treatment plans and support groups. And just to remind us that a survivor is anyone who has been diagnosed from day one. At one time, it was defined as anyone who had lived 5 years beyond their diagnosis. So we do this through two programs at the Department of Public Health. You might have heard of the Best Chance Network program that provides breast and cervical cancer screenings at no cost. And this includes clinical breast exams, mammograms, pap smears, and pelvic exams, HPV testing, diagnostic testing for abnormal results, referrals for follow-up care, treatment, and social services. So women who are eligible for this program, they must be a South Carolina resident. And for a cervical exam, they must be between the ages of 21 to 64. And for a breast exam, they must be 30 to 64. They also must be uninsured or underinsured, meaning that insurance doesn't cover essential services or have a high deductible plan like typically $1,000 or more. And they also must have an income at or below a 250% federal poverty level. The other program that we have at DPH is the Comprehensive Cancer Control Program, which I oversee, and we collaborate with organizations such as the South Carolina Cancer Alliance to carry out evidence-based strategies to help prevent and control cancer. The program partners with organizations to help all South Carolinians, but with a focus on the types of cancers unique to each community that have the highest burden.
So let's talk about, there's a lot of conversations, months about different cancers, weeks studying different cancers. What are the leading cancers in the state of South Carolina?
The leading cancers in our state are actually the leading cancers nationwide. But when we focus on our state, according to the South Carolina Registry data and the South Carolina Tracking Cancer Dashboard, we have about 6 or 7. Breast, I mentioned it previously, breast, cervical, colorectal, lung, oral, prostate, and skin. Now, the good news about this information or those cancers that I just shared is that, again, recent studies among all the groups show that the occurrences of new cancers have dropped and are continuing to drop since 2020. Cancer mortality has declined in both men and women for more than 20 years. But the not so good news, Tony, is that although cancer rates are declining, as I've already mentioned, it is still a public health concern. For example, in 2023, the new cases, there were like 34,800 people that were diagnosed in South Carolina with cancer. So that equates to like 95 people being diagnosed daily. That's 4 people per hour, and that's 1 person diagnosed in the time during this discussion that we're having. An example of deaths, like in 2022, an example, over 10,000 people died from cancer in South Carolina. That equates to like 28 people per day. And that could equate to 1 family member every hour losing a loved one to cancer.
Wow. We're talking with Sonya M Younger, the Director of Comprehensive Cancer Control at SCDPH. Well, of course, the question after all that information is going to be, what can people do to prevent these different types of cancers? Yes,
the great part. Thank you for that question, Tony. Well, there are several things that we can do. One, quitting tobacco. Now, smoking is a major risk factor for multiple cancers. Anyone who is trying to quit or have a desire to just even think and start about it, want to get some more ideas or information, they can call the 1-800-QUIT-NOW toll-free number or visit quitnowsc.org. The great thing about quitting smoking is that not only could it help prevent lung cancer, but studies are showing that if someone is currently being treated for cancer, quitting smoking can even help the treatment outcomes. So it's always a great motivation to try to quit smoking, whether you're being treated for cancer, survivor, or you've never been diagnosed with lung cancer. Maintain a healthy weight. I'm working on this myself, honestly, but achieving and maintaining a healthy weight helps to lower cancer risk. Being active. We all know that if we could aim for at least 30 minutes a day of exercise, that helps a lot. Eating a balanced diet, focusing on like fruits, vegetables, whole grains, and limiting the processed foods do help a lot.
Right.
Yeah, and we're going to talk about sun protection and this, protecting ourselves from harmful UV rays, using at least a 30 SPF grade or higher, wearing the protective clothing and avoiding tanning beds. And just a reminder that when it comes to this, we're talking sun protection from skin cancer, of course. Skin cancer can affect all populations. White, black, whatever have you. And interesting enough that when it comes to people of color, when looking for signs of skin cancer, we need to look at our nail beds in the bottom of our feet, which leads me into also, for all of us doing a skin self-exam, just doing a regular check of your skin for any new or changing like moles or spots, and early detection. And these efforts can really help us prevent cancer and save lives.
Yes, Sonya. So let's wrap up by talking about those early detection steps. Of course, there are different types of cancer, so that would definitely mean there are different ways to find out what may be affecting you in an early stage.
Right. Good question. So staying up to date on screenings, we at the Department of Public Health, we promote what's called the United States Preventative Services Task Force, or USPSTF for another acronym, guidelines. And if you go to the CDC or the American Cancer websites, they offer or they present these guidelines in a very user-friendly format. But let me add that the Department of Public Health, we promote these guidelines. But when you're talking with your doctor about your guidelines, follow the ones that fit your need. For example, it wasn't until recent that when it came to colorectal cancer, now research was showing that, African Americans should get screened earlier at age 45, while the guidelines were still saying that screening should start at age 50. So the USPS TF guidelines were not promoting that guideline per se. There are other guidelines that were promoting that. So I was trying to give you an example there why you should follow look for other guidelines that help you in your situation. If you have like a history of cancer and should get screened early, if families have knowledge that that the men in their family have prostate cancer, well, according to the guidelines, okay, start getting screened at age, I believe it's 50. And for your family, for that family, it may be earlier because there's a genetic strand perhaps going there, or there's family history of it that shows, perhaps the men in our family should get screened earlier.
Right.
So again, let me go back to your question that you asked me, and I've noted that already, but knowing your family history is important because some cancers are hereditary. So share your family history with your doctor to assess your risks, to consider earlier or more frequent screenings if necessary. I'll give you one more example. When it comes to colorectal cancer, when we look at that cancer, it says to get screened every 10 years. So, but the last colonoscopy that I had 3 polyps removed. So instead of going back in the next 10 years, I'll be going back in the next 5 years. So it will depend a lot of times on what a previous screening outcome was, or again, what your doctor might suggest. But let's also too talk about the fact that people of color are often getting diagnosed in later stages of cancer, meaning the cancer has progressed. An example there being that Caucasian women are being diagnosed more with breast cancer, but African American women are dying more from breast cancer. The diagnosis, when we are diagnosed in later stages. So the challenge is for, populations of color, African Americans, to get screened and get screened on time. And don't put this off because, again, if it shows up later, it could be harder to cure. And also, I just wanted to note, too, that not all cancers are screenable. And for these cancers, the USPS TF guidelines have determined that there's not enough current evidence to evaluate the overall benefits and harms of screening. An example being when you do look at the cancer registry data, you'll see that pancreatic cancer is a high-ranking cancer in the state and nationwide. But there aren't any screening guidelines out now for that cancer. But I'm going to reflect back too that since I've been in public health since 2010, when I first came on board, there were no screening guidelines for lung cancer either. And now there are. Those guidelines came out about 4 to 5 years ago. So there's progress that's still being made. And for those cancers, again, that are high ranking, but there are no evidence behind the screening, it is being conducted, and I believe it will come too in the near future.
Sonya, how can folks reach out to you?
Definitely. Feel free to reach out to me by email, and that's Young, YOUNGESM, at dph.sc.gov, or please feel free to call me at 803-898-1612. I have lots of resources and other cancer data information and programs I'd love to share with anyone.
Thanks so much to Sonya Younger. That's going to do it for this edition of the Data Pulse. See you next time.